Hi, Sarah. Great to have you here. Thank you for joining us.
Thank you.
Sarah, so Creed has had Luxturna treatment for both his eyes, I understand. Were they administered together or one after another? Can you just give us a little bit detail about how the treatment went and how he's feeling now?
Sure. He had his right eye done on March 21st, and then we stayed down in Miami, and he had his left eye done on March 28th. And, he's doing great right now. He's very overwhelmed. It's a lot of things have it's like teaching a toddler at this point, a lot of new things that he's never done, but he loves it. He wouldn't, he's very happy with what he says all the time is his new eyes. Going out, like the doctors were saying earlier, how there was a curfew for the time, and that was so true. We were constantly fighting against the sun. And now there's no rush. We can hang out outside even when the sun is setting. He can read books outside now. He can play outside now. And he's much happier now that this is all done.
Oh, that's great to hear, Sarah. Dr. Bennett, this is a very common question I've seen on forums and people asking whether people can get treated for only one eye.
Theoretically, people can be treated with just one eye. In our experience, at least in the clinical trials, everybody wanted their second eye injected, particularly after the first eye was injected and they saw how much their vision improved. So, yes, I would say it would be possible to inject one eye, although the SPARC is recommending that both eyes be injected if they have enough cells that could merit the injection.
Yes, and Dr. Maguire, you mentioned a week of time gap between one eye injection and the other eye being injected. Is there a reason or some considerations that we take into account when we decide this time?
So there's a sort of a history behind the interval. So from a view, it's felt that if you give the exposure to the virus a very short period of time, you are not priming the immune system to the second injection, so it's not going to act like a vaccination. So theoretically, the immune system will look at two injections within a 2-week period of time as essentially being a one injection, one exposure to this antigen, to this virus. It turns out, though, that one of the studies that we did earlier showed that patients who had the second eye treated in a safety study, the second eye treated sometimes years after the first eye, had no untoward reaction, had no major or minor immunologic response, and they also seem to have just about as much improvement in their retinal function as they did when we had a short injection interval. So that time period is really based on what was the minimum time between the two eyes, and just the idea that theoretically it might be better to have the second eye treated at a shorter interval to avoid an immune response.
Sarah, now that Creed is doing better, so what are some of the precautions that you take now that he's able to see and see better, that, as I said, his vision is improved? So are there any precautions that you're taking other than, of course, as you just mentioned, you're teaching him like a toddler? So we'd just like for the parents who are listening. Yeah.
I take a lot less precautions than I did before. I have to say I unfortunately regret coddling Creed so much. I've watched for 9 years now other parents with children visually impaired all the way to blind, children who can ride bikes and button their clothes. And I was a single mom for most of Creed's, most of the time until recently. And so I kind of coddled Creed and protected him and did not want him to get injured, and made sure that he kind of lived in his own little bubble. And now that he had Luxturna, the one thing I do regret is not challenging him a little bit more before Luxturna, because it's definitely, to me, and to him, it's been very overwhelming for both of us, because he no longer wants me to be right there over his shoulder, and I'm having to learn how to step back. So my precautions, I think the only thing that I am concerned about at this point in time is poking himself in the eye or something silly like that. There's nothing anymore when it comes to him running into the table or tripping over the dog or just walking into people in general. Those are not my concerns anymore at all, and none of that actually happens anymore either. So it's like the tables have been turned on both of us. So I definitely have to learn to let go at this point.
I hope that Creed is able to see his rainbow very soon, because
yes,
I've been reading about him wanting to see a rainbow.
Yeah, and it has rained every day for months, and we still haven't had one. So I was like, this is ridiculous. So hopefully soon.
Thank you very much, Sarah, for sharing that.
Yes,
Dr. Maguire, how long does it take actually for patients to recover and able to see an improvement in vision?
So we have actually documented that the retinal function can improve in the matter of days. We've done special testing of pupil response, and basically as soon as we tested, I think around 5 days after the procedure, we were able to establish, in fact, there's much greater retinal sensitivity. It's interesting because there are certain tests you can't do immediately in the postoperative period, but you can certainly ask patients how they're, what they're seeing and what they think. And I was struck. I didn't really believe it at first, but now I'm pretty sure it's true. I was struck on the day after surgery, patients complaining about how bright it was, and it's almost an overnight effect where they'll get much more sensitive and seeing light's much easier for them. Fortunately, that almost overwhelming light sensitivity that they get, patients get used to it after a few weeks, and it sort of calms down. So it's their new norm.
This is amazing, actually, to hear. And I can't but help smiling. If you could see me, I'm just smiling through this, hearing both of you talk about this great, absolutely wonderful treatment that now we have for the people who have LCA. So, Dr. Bennett, what is the data that we have on how long the patients retain their improved vision?
Well, we have more than a decade of data now, going back to the very first patients who were injected. The thing is, those first patients all received different doses, and so there are different variables that could affect their response. And all of them say that first injected eye is retaining vision, and we can measure that. However, our best data comes from the second eye that was injected, because all those second eyes got the same dose. And we are now nearing the 5-year time point on those patients, and so far they have maintained all of the gains that we measured early on, within 30 days after their injection.
Okay, so we do not have comprehensive numbers like 3 years, 4 years, or is that a progressive? Are you noticing a progressive vision betterment as they are progressing over the years? Is that how it is?
Well, the improvement basically it skyrockets early on. So by day 30,
okay.
People are seeing immensely better than they were before the intervention, and that what we're measuring there plateaus in terms of light sensitivity and other aspects of vision. However, we think that there are changes going on that we don't measure in a clinical trial, such as understanding what you're seeing. For example, we had one patient who was with us in a car looking out the window, and she had never seen tree branches before, and she had to be told what those were, and so she learned what tree branches were after her intervention. She learned what a reflection from a pond was. So these are a lot of abstract things that I think the person has to learn, and that's not something that we can measure.